Hi guys, it's Jazz Gulati here from the Protrusive Dental Podcast, and I really should be doing this live right now. Like, this would be such a great topic to have live on Facebook or Instagram to see people's comments and stuff. But unfortunately, the timings don't work out. Right now, the time is 4:15 p.m. and there's like zero audience for me, right? So I'm pitching this and recording this, just to the camera, and I hope you enjoy this. I've just been, one of those things where you just daydream and you sometimes get carried away. And I thought, you know what, this would make a really cool interference cast episode, which I haven't done in ages. So let's roll with it. These are 6 signs that you are a comprehensive dentist. And I also thought about calling it the 6 struggles of a comprehensive dentist, because every one of these signs I'm going to give you is a struggle. Now, one of the reasons I don't have the time to do this at like 7 in the evening or 10 p.m. at night when there's more people in the UK and more of a social audience in the USA as well, is because I'm actually, during those hours, so busy and focusing on the splint course that I don't have time for anything else at the moment. And the reason it's taken me so long, like up to 4 years now, and then a live course, and now finally the splint course going online, is that I just don't want this to be the best course on splints you've ever done. I want this to be the best course you've ever done. And that's a very bold thing to say. I never thought I'd say something like that, but that's the kind of sort of level I'm pitching at. So give me a little bit more time and that'll be out. So that's why I'm unable to if you don't hear from me outside of podcasting, I do apologize. I'm just literally immersed in that. But let's dive into these 6 signs that you are a comprehensive dentist. Sign number 1 is that you take your role, or you take your job, or you take your profession home with you. Right? I remember when I was in 3rd year dental school, I opened up one of those like dental magazines that you get from like Dental Protection or something. And there was these DF1s or these dentists that were just newly qualified and they were being interviewed, right? And part of the interview question is like, what do you like most about being a dentist? And this one lady, a young dentist, she wrote, or she said, and it was interviewed and documented in this book, was, I love the fact that I don't have to take my work home with me. I love the fact that I see my patients and when I'm done, I come home, I can switch off. And at that time, I thought, this is awesome. Dentistry is going to be perfect. I can't wait to qualify and be a practicing dentist because I can just totally do that, right? I can go to work, be an awesome dentist, come home, and that's it. My work is done. No one told me about the lifestyle I'm living right now, right? No one warned me it's something I'm living, and sometimes I think, is it just me? But from speaking to more and more of the Protruserati, of our tribe, okay, people who are like-minded, I'm starting to gather that this is a comprehensive problem. This is a comprehensive struggle, i.e. when I come home, quite a lot of times I'm doing clin checks. I'm doing treatment plan letters. I'm looking at my photos, planning cases. I'm looking at my photos, critiquing my own cases. I'm looking at my cases and thinking, okay, what can I post as something educational, something valuable? So it is by no means a 9-to-5 job for me. And if you're listening to this episode, I doubt it is for you either. Now, I contrast this to my wife, who is she's a great dentist. She is not a comprehensive dentist. And this is because her role does not permit her to be comprehensive. Now, for those of you who know my wife, her name is Sim. She is a community dentist. So if you're unfamiliar with this concept, in the UK, we have something called community dentistry. And she sees the most vulnerable groups of patients in our country. She sees very highly anxious children and adults. She sees patients with severe medical disabilities, and these people just cannot be seen in general practice. They need special care. They need special resources, which is just unavailable. They need inhalation sedation. So she is not a comprehensive dentist. It's just a completely different type of dentistry. And she comes home and she's just mum mode, wife mode. She does all the things that she wants to. She's a great baker. But you know what? Dentistry outside of 9 to 5, like there's zero, right? Other than the odd occasion of doing CPD or CE, like she is someone who can switch off. She's someone who doesn't bring her job with her at home. And you know what? I think it's nice, that this husband-wife relationship we have, that I am doing this comprehensive nature, try and work from home as much as I can because I need to, because I want to. And then she is there and she does so much for our family. So Sim, if you get to listen to this, thank you so much for everything you do. But I think that's why our partnership works so well, because I think if you're both like extremely comprehensive, it would be a real struggle in how do we fit family life, how do we fit a social life around that. So that was just me rambling, having a think. So it's a difference. So you might not be a comprehensive dentist. Now, I doubt it, because you listen to the Protrusive Dental podcast, and if you listen to this podcast, you're probably extremely passionate, and therefore you are struggling with these areas that I'm going to list. So I'm going to list 5 more in a moment, but just reflect on, if you're in a circumstance where you're not able to be comprehensive, then that's different, right? That's a different scenario issue. But one struggle for sure that you do: bring your work home with you. Sign number 2 that you are a comprehensive dentist, right? This is when you have had a morning of new patient examinations or a morning of recall examinations, and you absolutely hate those days or hate those sessions because they're so mentally draining. Right? Like I find, and I do find that comprehensive dentists find that it is actually really challenging. Like there's so many emotions involved in a new patient consultation. There's so much active listening to your patient, coming up with solutions to very complex problems. It's not easy, and for me, I'm absolutely shattered. I need to be constantly drinking, hydrating myself. So if you find that you are really, really struggling after a morning of checkups or new patient examinations, you're probably a comprehensive dentist. That's one of the signs that you're being comprehensive, because you're not just saying, "Hey, Mrs. Smith, everything looks good. I'll see you in 6 months." You're saying, "Hey, Mrs. Smith, you're doing great, but I need to discuss this with you. You have recession, which means that your gum is being now brushed away too hard. And look at this photo of your gum. It's so high. Have you noticed all these crack lines in your teeth? Can we discuss this? Are you having any pain here? Let's have a feel of your joint. You have a click on the right side. Do you know what this means, Mrs. Smith? This is when you've got a little disc on. It's like a hat that sits on top of your joint and it moves around, and that pops on and pops off, and sometimes that creates a click. Do you see where I'm going, guys? Right? So when you are a comprehensive dentist, checkups can be extremely draining. Not only are you having to do a lot of thinking, you're having to do a lot of speaking and explanation, and really trying to give your patient as much value as possible, because that's the nature of being comprehensive, right? You're actually diagnosing more. And to diagnose more, you need to apply yourself more. You need to really look for things. You need to be really switched on. You can't just do a fantastic new patient examination and you're feeling lethargic that day. It just won't happen. It'll be a substandard examination. Compare that or contrast that to when I'm doing composite restorations. Now, if I'm doing a quadrant dentistry, and I've got like an hour and a half, 2 hours booked for a whole quadrant of composites, I am so energized after that session. Like I've enjoyed myself. I've done a bit of artistic work. I've taken photos. I'm fine. But give me like 3 or 2 new patient examinations back to back, then I am absolutely shattered. So that's a sign that you're a comprehensive dentist. Number 3, you have more to say, more to give, and your nurse tells you that you talk too much, right? Part of diagnosing more, part of explaining things to your patients more, and part of having to just talk so much, and part of having to give, and also to have the time to take a full series of photos, have the time to pull out the intro camera, have the time to explain each and every stage. It's difficult, it takes time. Therefore, the struggle is that you will not finish on time, or you will never finish early, right? You're like, after a checkup or a new patient examination, you'll never finish early, or very rarely. More often than not, you're either going to finish right on time or at least a few minutes late, right? Because you're just you're pouring your heart and soul, and just before the patient leaves, you just want to give them some more information. You want to give them some more to think about. You want to give them a little bit more value, right? And it's because you care so much. And I find that when you care so much and you have so much to give, you're very rarely going to finish early. Number 4, you don't earn enough money. Now, I know that sounds kind of weird maybe, because surely, right, some of you are saying, hey, you know what, if you're a comprehensive dentist, then you're diagnosing more, surely you're treating more, and if you're able to do all that, then you're probably working on a fully private basis, and if you're working privately, you're like, ka-ching! It's not the case, right? I'll tell you a couple of reasons why it's not the case. Firstly is compare the hourly rate of the 9-to-5 single tooth dentist and compare the hourly rate of the comprehensive dentist, because the comprehensive dentist is not getting paid for all that planning usually. The comprehensive dentist is spending all this time to critique his or her own photos, looking through all the different ways they've done some treatment and how they could improve. And guess what? You're not You're not making money. That's not an income generating task, right? And guess what? You're also, as the part and parcel of being a comprehensive dentist, you're spending more money. You're buying camera, you're buying loupes, you are investing so much money on courses that it's unbelievable. Like if you told a non-dentist how much money, what percentage of your income you are spending on courses, they will think you're crazy. Right? So when you actually add the fact that yes, you potentially may be grossing more. Okay, I'm not saying it might be the case for some people, but by the time you add in how much money you're investing in courses, your education, your equipment, and the fact that you're working all hours a day and you're available for your patients whenever, wherever, on email basis, then maybe your hourly rate is not as high as it should be. But you know what? It doesn't matter because you do it for passion. You do it because you care. You do it because comprehensive dentistry is more fun than single tooth dentistry. And you do it because it's part of the bigger picture. Like you would be miserable if I told you that I double your income, your annual income, but you'd be a single tooth dentist. You'd probably say no, because you'd have so much more fun being a comprehensive dentist. And that's the sign that you definitely are a comprehensive dentist. Sign number 5 of the comprehensive dentist is that you will hear this from your patients over and over and over again. Like your patients will keep saying the same damn thing to you, right? And this is what they'll say. They'll say, wow, no dentist has ever told me that before. Or they'll say, if they're a positive person. If they're a negative person, they'll say, why hasn't any dentist ever told me this before? So there's 2 types of people, and those are kind of things you get. So the next logical thing is to tackle this, right? Like how do you answer this? What's the best way to answer this question? Well, I don't know what the best way is. Okay, so I don't know, but I can tell you what I say, right? So we never want to throw our colleagues under the bus, right? That's the worst thing you could possibly do, right? The best way that I found to handle it is I smile at the patient and I say, you know what? I love my job so much. I love the dentistry that I do. That sometimes I care more about the patient's teeth than they do. And we just laugh it off, right? It gets a little bit of a laugh and it just diffuses a potentially sticky situation, right? And it doesn't lead them into negative thoughts about, a different level of care or whatever. So I think that's a good way. That's how I do it. Let me know what you think. Please do message me. Follow Protrusive Dental on the Instagram. And if you like what I'm saying, hit subscribe on YouTube right now. But I've got one more sign for you. I hope you enjoyed that one, but I've got one more sign for you. And this is a funny one, right? Number 6, the 6th sign that you are a comprehensive dentist is that if someone stole your tablet or your phone or your laptop, right, they'd be so disappointed, right? They'd be like photos of teeth, like constantly videos, photos of teeth and gums and surgery and the odd screenshot of a lecture or the odd conference slide with the speaker and you're just there at a lecture taking photos, right? They would find your laptop or your phone so boring. And I think that itself is a sign that you're a comprehensive dentist. So I hope you enjoyed my little rambling here, interference cast, the 6 signs, the 6 struggles of a comprehensive dentist. Let me know what you thought. And I look forward to catching you in the next episode, which is going to be Ian Buckle talking us through digital occlusion.